So this morning's webinar is going to be hosted by our two practitioners, Jabe Brown and also Rebecca Hughes. And the sort of topic or theme that we're going to talk about today is how inflammation and underlying health conditions can influence your immune system, as well as a little bit of a recap on what's happening with the virus at the moment, as well as answering any questions that you have. So those of you joining us on Zoom, you're able to ask your questions in the chat box. So the little icon down the bottom, if you just click chat, you can pop your questions in there. Those of us joining on Facebook Live, just pop your questions down in the comments below and we'll get them through to our practitioners. So first of all, Jabe is going to give us a bit of a recap on what's happening at the moment. So take it away, Jabe.
Good morning, everyone, and thank you so much for taking the time to come along and attend. So what I want to do to begin with is just sort of give a bit of a play of what's going on in the world of COVID and where we're at the moment. And so clearly it's a thing, it's happening, everyone's affected, we're doing social distancing, many people are out of work, it's happening worldwide. The infection rates are increasing all over the place, but not everywhere. And we're doing our best to flatten the curve. The stats at the moment look something like this. About 80% of those who are affected are going to have mild or no symptoms. About 20% are going to require hospitalization, 5% are going to require ICU, and around about 1% are going to die. Now, the interesting thing about this, or interesting is the sobering thing, I suppose, more pertinently, is that about 40 to 70% of us are going to get this. So this thing, it's not going away, and so in some senses you should kind of consider it like the flu, in that it's going to be around, and many, perhaps most of us are going to get this. But then what will happen is we get this herd immunity effect, which is once you've got it, then you've developed immunity to it, and therefore you're not going to be a carrier. And so that's coming in the future. At the moment, though, it very much is about flattening the curve so that our health system doesn't get overwhelmed. And essentially that means, if 20% are going to hospital that get it, 5% require ICU. If we can't do that, then that number of that 1% increases. Now, most of that stuff, at this point, people really know, but I think it's important to keep on saying how much of a big deal it is. Even though you're obviously on our webinar attending to it, you probably know a thing or two. But the things that aren't talked about much is who's getting it, and what you can do about it to minimize your chance of getting it. And so of the people that go to hospital, 75% of them have a chronic disease condition, have an underlying health condition. And that's something that, it's bad if you're one of those people, but it also means that you should do everything that you can to try to resolve that. And so this is the time where we get to really try and figure out what we can do about our health. Now, that chronic disease condition, a lot of that really comes to inflammation is what we tend to cause it, because there isn't a single disease condition that doesn't come along with inflammation. And so what we want to talk about today is how your health and how inflammation can affect your immune system, and why that is relevant given what we're all going through now. And so inflammation is a pretty general term. Most people are going to think about it as if you get a bruise, then you're going to get inflammation, or you're going to get a cut and it's going to get red and then you get inflammation. And that's true. That's basically you have some trauma locally and the immune system says, right, let's send all the troops there. Let's get some immune system activity there and clean stuff out and repair it. And it does that through inflammation. So inflammation is actually a desired response by the body to deal with a particular problem. And so in an acute sense, inflammation is desirable. You don't want too much because it hurts. You don't want it to go crazy, but you do need it there. Otherwise, your body can't respond. But what can tend to happen is as you get a chronic health condition, inflammation becomes just a part of the way that your body deals with it. So if you've got a condition that requires an inflammatory process, so if it's autoimmunity or metabolic health concerns, then inflammation is going to be one of the responses that happens by the body. And that's how your body is trying to deal with it. The problem is that the inflammation becomes a problem over time, because as inflammation becomes chronic, it depresses the immune system. And so as we talk about this COVID thing, what we get is people don't want to get sick. And so what we're doing is we're doing everything we can to treat the disease, but we kind of need to remember, and one of the things about functional medicine is we're better not to treat diseases and conditions and symptoms, we're better to treat patients. So in this case, the patient is you. And what we can do for ourselves is try and resolve our inflammatory stressors and our chronic health conditions, which really means we come back to what in functional medicine world we call the 4 pillars, and what it is that you can do for your health. Now I can see some orange flashing there, Courtney. I don't know what that's about, so I think it's probably a good time for me to pause and invite questions and see if there's anything anyone want to press me on that I've been speaking about.
No questions. Everyone's just saying good morning.
Good morning, everyone. Good morning. Okay, so we want to take this problem that is SARS-CoV-2 and how it's impacted our life. It's impacted our life by most of us practicing social distancing, and that means isolating. Now, that doesn't mean we have to do social isolation, because we can be connected by doing things like this. And while I think it's very natural to take the need to social distance as some kind of punishment or thing to endure, I actually think we can reframe a lot of it and use it as an opportunity. I mean, I hear all the time people saying, oh, I've got so much work and I wish I could take time and pause and spend more time with the kids, or I want to learn a musical instrument, or I haven't made time to read a book. I think this is an opportunity to do all of that. But more broadly speaking, this is an opportunity to do what is currently socially good, but also good for you. So if you can improve what's going on with your immune system, not only does that decrease the chance or the impact of corona, but it also, you're doing your bit of social good as well, in that you're not going to be the one that's going along and requiring hospitalization, and you're less likely to transmit. And so the socially responsible thing, and the thing that's good for you, is to do what you can for your health. And so today we want to speak about that, and again, those 4 pillars. But what I might do is throw over to Rebecca, and let's see if we can learn a little bit about how food might be impacting or able to impact on our immune system, and what we do for coronavirus.
Good morning, everyone. So I suppose food being one of the pillars that we talk about in functional medicine, there are many ways, in fact, it can impact inflammation. And I think also the word inflammation is sometimes loaded, being that inflammation is bad, as Jabe said, but there are different types of inflammatory chemical mediators, I suppose, throughout the body. And some of them are protective, and then some of them are damaging. So we also need to keep that in mind, that the function that these chemicals are performing. So, you know, I think a lot of people have identified, either with testing or just through their own personal experience, that certain foods have, you know, they have bad reactions to these foods. And one of the main foods that we know about through well-documented research is that gluten is a highly inflammatory food in most people. In fact, it causes transient inflammation in the digestive system of, I think, about 90% of people that eat it. So, and that's just one food that's well studied and that we're well aware of. But individual people have individual reactions to specific foods. So if you know that you're one of those people that has those reactions, then that could be something that you could start to address now. You could start to identify what are those foods that are causing inflammation, discomfort, or even pain, changes in your physiology that you might be aware of, and start to identify and eliminate those types of foods now. And, you know, there are lots of what we call measurable and immune mediated forms of food intolerance reactions, which might be frank allergy, but most people know if they have a frank allergy, or it might be what's called food sensitivity or food intolerances, which some of those can also be measured and identified. Some of them can't, such as, you know, salicylates, amines and glutamates. They also cause an inflammatory response in some people, but unfortunately we don't have any tools to measure those at the moment. But what we can do through, I suppose, through clinical questioning is work out, are you sensitive to those foods, and do an elimination diet. But ultimately, an elimination diet, which includes removing those foods for a prescribed period of time, whether the immune response is immune mediated or not immune mediated, the elimination diet and the removal of those foods is essentially the prescription for a period of time to work out what's going on with your body and food and how it's eliciting that response. So that's just one thing, and also particularly important if people have autoimmune conditions. Usually they have associated food intolerances that aggravate their autoimmune conditions. So autoimmune conditions are things like rheumatoid arthritis, lupus, Hashimoto's disease, Crohn's disease, ulcerative colitis. Just to name a few. There's a broad range of autoimmune conditions. And those people are already in a chronic state of inflammation. So it's very, very important for them to moderate and control the amount of inflammation that they're in general, like in life, but also particularly at this time.
So also the basics too, right, Rebecca? So it turns out that one of the most inflammatory things that you can do is spike your blood sugar levels. And so if you're spiking your blood sugar levels, that's basically a viral, it's like viral fertilizer, so to speak. It's kind of like, yeah, come, I'll be susceptible. And so if you don't want to spike your blood glucose levels, then it's really, really simple stuff. It's avoid packaged food and highly carb foods and refined foods. They're really, really simple things, but it can make a big difference. And then get whole foods, which can give you all of the immune nutrients.
And also overeating. Like I was reading some interesting research about how overeating stresses the mitochondria. And so the mitochondria are the little powerhouses that we have inside each of our cells that produce energy. And so when we overeat, we can stress those mitochondria and eventually they'll stop doing their job. And interestingly, the heart muscle has more mitochondria than any other tissue in the body. So people who perhaps already have pre-existing issues with their heart, even as simple as high blood pressure, probably need to be careful about overeating. And I suppose during this time when people have more time on their hands and they're at home more, and maybe it might be more inclined to eat more than they usually do, that this is really an important time to be across that and to not be overeating. And maybe, you know, as Jabe pointed out, practicing some healthy habits, it could be a useful time to experiment with intermittent fasting, for example. This could be a good time to do that when you know that you're not going to be taxed or stressed by other activities in life. Sometimes it's a good idea to practice with things like intermittent fasting.
Absolutely.
I jump in with a question that we've just got through. So someone has asked, how would I know if I was having an inflammatory response to food?
Do you want to take that, or shall I?
I suppose, look, there's lots of different signs and symptoms to inflammatory responses in food. For some people, they experience it just in their digestive system. So they might experience bloating, pain, discomfort, maybe alterations in how their bowels move. It could move to being really loose or being constipated. It's pretty unique. And then there might be other responses such as joint pain, skin rashes, even flares in asthma-like symptoms. These could all be food intolerance reactions. But unfortunately, with actual sensitivities and intolerances, is that they can act up to 72 hours after the person's been exposed to the food. So whilst you might know that you're reacting to foods, actually identifying those foods can be quite difficult without the appropriate testing.
Yeah, good response. I think that now's an opportunity to do the basics with food, and do those before you really try and figure out and do any kind of elimination and try and figure out your specific things. But do the things that are obvious. Cut down on the sugar. That's a big thing. Avoid all of the packet foods. I mean, I know we're using packet foods because you don't want to use fresh foods, but fresh foods are where all the nutrients are. For your immune system to function, you need the fuel, and you get the fuel from food. So this is the time where you want zinc and you want vitamin A and you want vitamin C and all of the rest of it, all of the plant compounds, and they come from real food. Your immune system also requires protein. So get protein. Zinc comes along with protein. Have your bright colored vegetables because they're rich in phytonutrients and vitamin C. And this is the stuff that makes a really, really, really big difference. If you have someone in hospital and they're feeding them only through an IV tube, then one of the most important things that you can do is make sure their blood glucose levels stay balanced, because if they go too high, they get sick. So don't spike your blood glucose levels really high. Have real food. But as Rebecca said, this could be an opportunity if you're stuck at home and there's less high stakes when you're interacting with people. Maybe this is when you try on intermittent fasting. If you are intermittent fasting, maybe this is where you do an extended fast. If you're not comfortable with any of these things, then do a little bit of time, learn. If you're a patient of ours, give us a buzz, and we'd love to help you through it. But take this as an opportunity to do the things with food that you kind of secretly knew you should be doing. Or if you are a patient and you know the details, this is the time to double down and make sure that you really are doing the right thing for you, but also for society in terms of what's going on with coronavirus. So food's one of the parts of it, but another really big part of health and your immunity is stress. And if you're a patient of ours or of mine, you'll know I'm always banging on about stress and how it affects the physiology. But now more than ever, it's a big thing. Stress has just about more of an impact on the immune system than just about anything else. It's big, it's real. So 36 hours of stress will decrease your body's production of secretory IgA, I use this one all the time, by 80%. That's your body's first line mucosal defense that you spit out everywhere. 80% in 36 hours of stress. Stress will decrease your white cell response. So your white cells are kind of like your immune soldiers that are cruising around. It has a very real impact on what's going on with your immune system. And it's a really easy time for us to panic at the moment with what's going on. It's an unknown, and it's natural to have fear when you are not in control. But that doesn't mean that you need to panic and create an anxiety around it, because they are never helpful. And they're certainly never helpful to your immune system. And so now is the time where you can try and do the things that you know that you should be doing to manage stress. Haven't been able to find time to meditate previously, always wanted to learn. Well, now's your opportunity. You've found more time in your day, I imagine, if you're not driving. But it's a thing that if you just devote a little bit of time to it, you can learn and then add it to your tool belt of skills in changing your stress response. But this is the time to do online yoga, Tai Chi, Qigong. Go for walks in nature. I mean, in Melbourne it's a bit cold at the moment, but get out there anyway. Time in nature is good. Laughter's extremely good for the immune system, as is love. This is a time to connect to your loved ones. And while you are socially distanced, you do not need to be socially isolated. And that means picking up the phone, using Zoom, reaching out to people you haven't spoken to in a while, and just say, hey, get connected. Not only does it feel good, it's good for your immune system, and it's also therefore good for this whole pandemic. And if everyone were doing that, less people would get this, and we'd have a better prognosis. And so, again, take this as an opportunity to do the things that, on some level, would be good for you to be doing, but that you perhaps haven't prioritized or made time for. And so, stress, in my mind, really is one of, if not the biggest thing that you can do for your immune system. Rebecca, do you have any thoughts on that?
No, I think more just, I suppose, what you said about managing your mindset around what's happening, I think, is a really critical part of this time, because there's obviously the fear of the actual virus, but then we're being, I suppose, asked to live in unusual conditions and circumstances, and like you said, it could occur as punishment or something that we have to do, that and being deprived of things, but reframed can be a really positive time of life. And I think it's just being mindful of that ongoingly, because particularly when we're exposed to lots of media that can really heighten anxiety. So I guess if that's something that you know that you're sensitive to, is probably reducing the amount of social media and media that you find distressing could be actually useful in this time.
No, good one. Courtney, were there questions that have come out?
Yes, there is. There's one that's come up, and it's just regarding our viral immune formula that we have. So a patient that has it has just asked, do I need to be taking it 3 times a day every day, or can I just take 1 dose a day and then increase to 3 times a day if I feel a flu coming on?
Okay, so that formula has herbs that would put in multiple actions so that we don't need to get people to have multiple products. And so the first goal we're trying to achieve is decreasing susceptibility to coronavirus should you be exposed. And so if you were exposed to someone with coronavirus, the idea in that formula is that you're less likely to become infected. And so in that sense, if you have exposure, you're best off to use it regularly in the 3 times as directed. If you're not being exposed to it, then I probably wouldn't bother. If you're sitting at home by yourself, you're not exposed to anyone, or the people that you're with have been socially close to anyone else or potentially exposed, then put it away and save it. And so that's the first usage of it. The second is that we put herbs in there that will improve your body's response should you become affected by coronavirus. And in that situation, you want to be doing it regularly, the same as you would do for any immune stimulating formula. And so regularly, if you've been exposed, and do that for a short period of time. Regularly, if you are infected, and do that until you are not. And otherwise, just keep it in the cupboard in case it becomes relevant.
Good, thank you. Just quickly, so we're hitting about the 30-minute mark, and I know we wanted to touch base on all 4 pillars. So do you want to quickly speak to our remaining 2 pillars of the 4?
Absolutely. Rebecca, do you want to take sleep?
Yeah, sure. I think it's fairly well understood and characterized by now also that sleep deprivation is a form of stress. So it contributes to the stress that Jabe was just talking about. But it also serves its own functions in terms of restoration and repair, and then adequate immune response. So it's pretty well understood that people who are continually sleep deprived, that their body's ability to launch an appropriate immune response to bacteria and viruses and pathogens in general will be completely diminished. And I suppose there's a little bit of debate about what's considered to be adequate sleep, but most of the literature will say that for adults, 8 hours of sleep, for school-age children, about 10 hours of sleep, and for preschool-age children, probably 12 to 14 plus hours of sleep, depending on their age, because it's more in infancy. But that's actual sleep. That's not going to bed and reading, or going to bed and listening to an audio book. That's the actual hours that you spend sleeping, and rested sleep that's not interrupted. And what I would say from being in practice is that sleep deprivation appears to be its own epidemic in our society now, that a lot of people do not get adequate sleep. And even if they're in bed for 8 hours, the quality of their sleep is terrible. Like, they report, waking up several times a night, feeling unrested, not getting into the deep sleep state. And I think that's a little bit of obviously a function of perhaps the pace that we've started to develop in our society, and the level of work that people expect of themselves. So again, this is a period of time in which to get lots of habits back in line and healthy practices, and sleep is a pretty easy practice to get back in line if it's been out of out of balance for you, because it doesn't really require that much of you, I suppose, besides maybe a little reparenting of yourself and putting yourself to bed at an adequate time. And also the hour of sleep is supposed to be also quite indicative of the quality of the sleep that you get. So the more hours that you can get to sleep before midnight usually confers a better quality sleep outcome in the morning. Sleep deprivation is also associated with, with certain pre-existing conditions, which is one of the things we wanted to talk about today, and in particular, high blood pressure. So sleep is one of the times of our 24-hour cycle where actually our blood pressure naturally drops. And but if that's not happening, if you're not getting adequate sleep, the blood pressure isn't adequately dropping, which isn't, I suppose, providing enough rest for the heart muscle. But it also, some research shows that sleep deprivation will also increase more inflammatory markers in the lining of your blood vessels, and that seems to be a link between heart disease and hypertension. That seems to be the link between heart disease, high blood pressure, and sleep deprivation.
Okay, wonderful. I very well said on sleep, and I think a useful tool for people is to try and think about what it is that the body is doing and why. And you can use that for all of the 4 pillars. And so what's happening while you're asleep is that you are not walking around. You don't need to be speaking with people. Your eyes aren't working. And so all of those functions are shut down, and therefore they're not requiring any energy. They're not requiring the body to do anything. And so the body is going to spend its time prioritizing and allocating its attention to other things. And that's where it does its repair. That's where it does a huge amount of your immune system work. That's why young kids need so much more sleep. It's because their body is relatively doing more changing. It's doing more in the way of growth. As you age, obviously we do less in the way of growth and we do more in the way of repair. That's why you need less sleep, because you're not doing the growth, but that's where the repair is. And the repair is with your immune system. And so it kind of makes sense. If you're not doing well in any sense of the word, sleep. When people get really, really sick, or they get injured, they sleep enormously. That's when the body heals. And so you can apply the same sort of methodology or thinking with stress stuff. When you're stressed, then your body's going to be spending a lot of time working on stress hormones and the stress hormone response, and making sure that you're okay to run away from the lion. And that means it's relatively doing less for the immune system. When you're having bad food, then it's spiking your glucose levels, and you're not getting the nutrients, and therefore inflammation's going up. And you're, again, not getting what you need for your immune system. And so use that as a bit of a tool. Think about, what is my body trying to do now? What is it prioritizing? And then try and get it to prioritize whatever it is that's important for you at the time. For food, again, get into a relaxed state, and your body's going to do better at digesting. You do better at digesting. That means you get more nutrients. Your microbiome does better with good food. We didn't speak about that earlier. And so use that tool pretty much always. And I think it's useful to get out of our head in terms of what you want at the moment and what feels good, back to what's important for the body. And so the last pillar that we haven't really covered off there is exercise. Now, obviously you can't exercise in the same way that you normally would now that we're doing social distancing. I read something the other day that we can do boot camps, but only with a maximum of 2. One of which is the instructor, which I think just makes it personal training, but distance. But just because you can't get in there to the gym or go to your climbing or your basketball or whatever it is, doesn't mean you can't exercise. And the body needs exercise. As human beings, we are made to move. This whole thing of sit for 8 hours is alien to our bodies. We're designed to constantly be moving. And so this is a reminder to all of us myself included, that we perhaps need to get up from sitting down and have a bit of a walk around or do some body weight exercises at home. And our body certainly appreciates it, brings down the inflammatory response. Our immune system appreciates it. And you don't have to be doing incredibly complex or active things. Just do something, get some movement. Your body will appreciate it. Rebecca, do you have anything to add on that?
Oh, no, just that there are a lot of online resources. Like I've been doing a lot of dance classes in my living room this week, which is heaps of fun, and nobody can see you, so you can really let loose. So it's a good time also if you've been secretly wanting to become a dancer or whatever thing that you've been wanting to practice. This is a great time as well, to practice those things and learn those things. I've been learning guitar as well, so it's a good time.
You're absolutely right. This is the time when you can do the stuff that you've been wanting to do. And movement in particular, I think you can hit multiple objectives at the same time. So if you're doing movement with yoga, then you're getting the de-stress component as well as the movement. And the same if you're doing a qigong or a tai chi. If you get some running around after the kids and you've got some laughter happening, then you're getting laughter and movement. And so you can achieve multiple things here. And as Rebecca said, it's a really good opportunity to do the things that perhaps you've been wanting to do for a while. Now, Courtney, I think we've spoken enough to 4 pillars based on the time that I'm seeing down below. Are there other questions, or is there anything else that's come in that we need to be speaking to?
Yeah, there's 2 questions, so we might wrap it up with these 2. Rebecca, I know you've seen the question here about sleep. So someone has just asked, is the required 8 hours from the time that I go to sleep until the time I wake up, or is it 8 hours plus, the one that I accumulate from micro awake times? So Rebecca, do you want to speak to that first, and then I'm going to throw back to you, Jabe?
Well, our sleep, it's true. Those trackers and Fitbits, etc., do track what sleep phase you're in, and so usually our sleep cycles are roughly 90-minute cycles, and the first few hours of probably about the first 2 to 3 hours of sleep are usually the deep sleep state, and then as we progress through the night, our sleep becomes what's relatively termed as lighter, but as we move toward REM sleep, which is earlier in the morning. So there will be times when you're in a deeper or a lighter sleep state, depending on where you are in your sleep cycle throughout the night. So that's probably what those devices are measuring. And what I also forgot to say about sleep is be careful about using alcohol to sleep and to wind down and de-stress, because it's not really great for your digestive system. One serve of alcohol can make your digestive system incredibly permeable and inflamed, but also it raises your body temperature. So one of the things that happens when you're getting into a deep sleep state is that your body temperature is dropping, and that's what has you go into that nice slumber. But alcohol actually raises your body temperature. So whilst it might seem like it's good for taking the edge off and helping you relax and go to sleep, ultimately it's going to keep drawing you out of that deep sleep state.
So I think that's something that we don't often think about, is that when we think sleep, what we somehow assume is that that's a lack of consciousness. And so something like alcohol, like you're talking about, kind of sedates you, but that's not, your body is busy working on getting rid of the grog, not on doing all of the restorative processes of sleep. In terms of the 8 hours or not, what the research is showing that that's 8 hours accounting for sleep efficiency. And so sleep efficiency is when you're actually asleep. So let's say you're in bed at 10, but it takes you half an hour to go to sleep, then that half an hour doesn't count. And if you're having waking times throughout the night, then they don't count. And so for many people, sleep efficiency is somewhere around about 85%, meaning most people need sort of 9 hours of what they think of as sleep time. But yeah, so to answer that question, it is 8 hours accounting for sleep efficiency. Courtney, I think you had another question.
Yeah, I just want to finish off on a little bit of a recap. So obviously our topic today was looking at how inflammation and underlying health conditions can influence our immune system. So Jabe, do you just want to give a bit of a brief overview of what we mean by health conditions, so people can sort of think about, I think that might be me.
Okay. So 6 out of 10 people have a chronic health condition, and it can mean a whole lot of different things. And so some of them, people are highly aware of what's going on, and so we've got diabetes, but for many people, they're not going to be aware of that, and they have pre-diabetes. In fact, 1 in 2 people in America, at least, and I think it's the same in Australia, either have diabetes or pre-diabetes, which is alarming. So we always talk about autoimmune conditions, cardiovascular conditions. So that 6 out of 10 is really talking about diagnosable disease states that you could get a label on. And so for many people, they've gone and got that label, and they've now got a medication to help treat that. If you're on a medication, you most realistically speaking have a chronic health condition, maybe except if it's the oral contraceptive pill. But there can also be other underlying things that you're not aware of. And so if you've just been just dealing with your gut stuff because you haven't been able to get any answers on it, then that's something that your body is struggling with. It's having problems, and so that counts. If you're getting a bunch of inflammation in your joints, and you just go, oh, it's just me aging. Maybe it is, but if it's kind of happening everywhere, maybe that's an overactive inflammatory response. And you've got skin stuff going on, that's a sign that your body's upset. And so what you really want to be thinking is my body able to allocate as much attention as it should be able to my immune system, or is it busy doing other stuff? And the more other things you've got going on, I got a few aches here, I got some skin stuff there, I got some mood disturbance there, and I got some gut stuff. That's a lot of attention that your body's going to place on not dealing with the more underlying things. And so I suppose to answer that question, it becomes, inflammation's a very catch-all term, but that doesn't mean that it's not important. So the basic gist of it though, is if your health isn't the way that you want it to be, then now's the time to take action on it and fix it. And so get some help. We'd love to do that. If you're a patient of ours, then now's the time to double down and follow through with your treatment plan. And if you're not, now's the time to start taking action and try and get your health sorted out. It's what's right for you with coronavirus. It's what's right for your family, and it's what's right for society. And what a great time to do it. Courtney.
Thank you, Jabe, and thank you, Rebecca. So we're going to leave the webinar here. So thank you all for attending yet again today, and thank you for all your questions as well. So as Jabe said, if you are a current patient and you need support, remember to book in calls with your health coach or book in a time to have an appointment via telehealth with your practitioner. If you are not a current patient, we still are offering our Immune SOS health sessions as well. So they've been quite popular. So make sure that you are booking in to get that. Also, thank you for joining, and have a lovely Easter as well. So keep maintaining your social isolation, your distancing, and hitting all your 4 pillars, and taking care. And we will see you next week for another webinar. Bye, guys.
Thanks, everyone. Bye.